My friends, we are now well into year 2 of a new era of our healthcare reform system, the era of cost control. In 2012, the state legislature established annual health care spending targets. It was the product of a long dialogue about the rapid growth of health care spending and its impact on society at large. As this House declared several years ago, the past of health care inflation is unsustainable. In an era where health care dollars are finite, we have worked to ensure that quality is maintained and even improves. Affordability is an essential component of accessible health care. So this society chose to help shape the debate because, as the saying goes, if you're not at the table, you're on the menu. Let's take a look at where things stand and where there is still a lot of work to do. First, regarding health care costs, the state's report card shows that after the first year, spending across the state rose just 2.3% last year. That's the smallest increase in years, much lower than the target of 3.6%, and even lower than the overall national health care inflation rate. This is evidence that the entire health care community in this state took the challenge of affordability very seriously. Where the trend goes from here is very uncertain. It's likely that future spending targets, which are much tighter, will be even more challenging, particularly when economic times are difficult. As any economist will tell you, when economic incentives change, behavior will follow. So let's look at what's been happening so far. We've seen new payment models emerge, which impose limits on spending and seek to reward good care. New technologies have arisen to serve these needs. We've seen a new round of hospital and practice consolidations and now 2 hospital closings. I suspect we've not seen the last of them. This, in turn, has prompted more physicians to move from independent practice to employed status. We don't yet know precisely how this will affect the delivery of care. We've also seen changes in the use of prescription drugs in the care of our patients. For the first time, even successful new drugs are coming under scrutiny because of their very high cost. In this era of limited resources, new questions are being asked and we need new answers. Our advocacy focus is changing too. In most years, we've spent most of our time on legislation and relatively little on regulation. But this past year, the balance between those two has flipped upside down. First, we were able to successfully conclude a 2-year campaign to ensure that the state's new EHR mandate is implemented without plunging our healthcare system into chaos. Initially, the prevailing winds on this issue were against us, but thanks to a thorough, nuanced campaign by our government relations staff, with significant support from physicians at a critical time, the Board of Registration in Medicine has issued a reasonable set of regulations. For this, we extend our heartfelt thanks to the members of the board and their staff for their work, and we are very grateful to our staff and every physician who participated for a job very well done. Second, in face of a terrible drug epidemic in our Commonwealth, we have worked closely with health and public safety officials to update and improve the prescription monitoring program, which still has more work to go, without creating new barriers to good health. On the other side of the ledger, we still have work to do on the administrative requirements established by the 2012 cost control law. We believe that the new registration requirements for practices in hospitals with financial risk are excessive. Since this rule affects almost everyone, it's important that we address this in the new administration. The last impact I want to discuss is the advent of true team-based care in our medical institutions. We all function within teams that are more integrated and more interdependent than ever. Some advocacy groups have tried to use the opportunity to exert their control over the process, but so far we've been able to turn them back. Your Committee on Legislation is working next year to develop legislation that will ensure that physicians are in the leadership position of these new teams. In addition, the board has asked me to appoint a new task force on interprofessional care to include representatives of other professions on the team, to work on roles for each team member and on education for physicians on how to function as a team leader. Dr. Dunlap has agreed to chair this task force, and the appointments are being finalized now. Physicians have the broadest and deepest training of anyone on the team, and the buck stops with us. The safety and well-being of our patients depends on this legislation becoming a reality. However, while advocacy is an important part of our medical society's work, it is not the whole story. This new era of healthcare is actually transforming almost everything we do. Our practice management team, the Physician Practice Resource Center, has focused its efforts on providing physicians in large and small practices with the new tools to thrive in this new world. Its practice consulting portfolio is larger than ever. Our continuing medical education team is developing materials that provide physicians with programs to address those issues that can't be found anywhere else. And our membership development team has developed a hybrid marketing strategy that puts the society's best foot forward for both individuals and the practices or groups where so many of them are working. There's a renewed effort to ensure that we engage with younger physicians on the issues that are critical for their future, which are often very different from those of us who preceded them into practice. We must make their membership and engagement in the medical society one of our highest priorities. These are all complex issues to deal with, and sometimes it's even harder to communicate them. We must prove our value to our colleagues and our external stakeholders each and every day, because that's what they have to do in their world too. It's a challenging world, but the MMS is in the right place at the right time to make a difference. And this brings me to my final topic, the role of leadership in making all of this a reality. By definition, as a delegate, you are a leader in this medical society. And as an ambassador of this organization, you lead by example in what you say and in what you do. Many of you, including this morning, have commented on the length of my badge, and you may have noticed that I continued to wear it, even though I usually take it off when I'm on the podium. It's so long because it represents the affiliated organizations that I support. And I assert that it is also very important that every member of this House join me in supporting the society in other ways, specifically by providing personal financial support. I urge each of you to consider becoming a life member of the MMS. And in addition, to provide annual financial support to our charitable foundation, Physician Health Services, the Massachusetts Medical Benevolence Society, and the Boston Medical Library. These organizations make a difference every day, but they can't do it alone. They need you, and we need you. If you're already an active, frequent supporter of these entities, thank you. If you have not supported them so far, please consider stepping up and doing so at any level you can. I know medical students and residents are stretched thin, but even $1 from a medical student or resident means a great deal when donors are counted, which they are when we are seeking outside support. I hope we can get to 100% of the House participation. That would be a real stretch, but it would make a huge statement. Your example speaks volumes to your colleagues. Mr. Speaker, this concludes my report.